Thank you, Madam Speaker. Honourable Acting Prime Minister, Honourable Leader of the Opposition, fellow Members of Parliament, I rise today to provide insight into the vulnerability of young workers in the workplaces in Fiji. In particular, this is in relation to the theme for this year's World OHS Day, which was celebrated last month and was focused on improving the health and safety of young workers. According to the International Labour Organization, there are 12 work-related injuries every second. Every second, 1 second gone. 12 work-related injuries already happening around the world. And 325 work-related deaths each day. Work-related illnesses and injuries, illnesses and deaths impose costs on employers, workers in the community, and because of this, it is critical for organizations and everybody to make employee safety a priority in Fiji. Over the past few decades, there has been rapid uptake of automation, artificial intelligence, and as a result, there have been wide discussion on fears about the transformation of the workplace and the effect on unemployment as more and more people are replaced by machines. With this has come the fear that people will lose jobs as a result. The use of these new technologies, however, makes it possible to automate difficult or dangerous tasks, making it safer for those who do those jobs, so workers can then work in safer environments. Madam Speaker, exposure to substances in the workplace can pose significant health risks to workers. The World Health Organization reports that air pollution accounts for an estimated 3 million deaths each year. Rapid industrial development in a lot of countries has led to hazardous levels of water and air pollutants. The Health and Safety at Work Act, which my ministry is responsible for, and the ministry is working to address this through a stronger national occupational health and safety culture, the development of such a culture. And that is what the Health and Safety Act is all about, and its implementation is all about. It's about developing that culture where the right to a safe and healthy work environment is respected at all levels, where the government, employers and workers actively participate in securing a safe and healthy working environment through a system of defined rights, responsibilities and duties, and where the highest priority is accorded to the principle of prevention. A culture of prevention requires that special attention be given to hazardous sectors and vulnerable workers, which includes the young workers that we have in our country. Madam Speaker, according to the ILO reports and stats, there are about 541 million young workers. These are between the age of 15 to 24 years old, which includes 37 million children that are in hazardous child labor. This age group of our young is very vulnerable in the workplace for a number of reasons. One, of their physical state of development, their psychological state of development, the way that they think, their attitude towards life, their lack of work experience, the lack of full appreciation of the dangers of what they face, the lack of training, the lack of knowledge and skills in the things that they are facing every day in the workplace, their limited awareness of work-related hazards that they face, and also a lack of bargaining power. And because of this, young workers a lot of them tend to accept dangerous tasks or jobs with poor working conditions. And many of our young seem to always have this gung-ho attitude towards risk and danger, with the belief that because they're young, they can deal with things, they can lift heavy weights, they can not be so careful in the way they go about the work that they do, not realizing that the impact of that will be felt in 2 or 3 decades' time when they become older. The World Day for Safety and Health at Work highlighted the importance of addressing these challenges and improving safety and health for young workers, not only to promote decent youth employment, but also to link these efforts to combat hazardous and all other forms of child labor. We want to promote generation safe and healthy. In other words, a new generation of workers that are not only productive, but they are also safe and healthy. Generation safe and healthy, and highlight the importance of improving safety and health for young workers and our generations that will follow us. Last month, my ministry joined hands with the International Labour Organization and the tripartite partners to continue advocating and working together to address the vulnerability of young workers in the workplace and to develop measures to curb it, measures to address it, to be done by the different tripartite partners. And this includes the representatives of workers, the representatives of employers, and also government. Workshops were conducted in Lambasa and Lautoka for more than 350 participants. These participants came from workplaces, tertiary institutions, and schools also. Oratory contest was held for young people from tertiary and secondary schools to raise awareness on the vulnerability of young workers in the workplace. So the focus of all of these exercises was to get into the minds of the young so that before they come out into the workplace, they are aware of the dangers that they face and they can fine-tune their minds to the importance of this. The first ever occupational health and safety practitioners conference was organized by the Fiji National University in partnership with the Ministry and the International Labour Organization. It was conducted in April last year. It was attended by more than 150 OHS practitioners in Fiji. And I believe this is the first time that we have managed to get all the occupational health and safety practitioners together into a national conference to look at the key issues that affect them. Issues affecting the young workers in the workplace, such as manual handling. How do you handle things? How do you handle things so that you do not have a detrimental impact on you when you're old? Work stress, non-communicable disease, workplace economics, chemicals and dust. All of these were discussed to see how we can try to reduce its impact on our young workers. This National Occupational Health and Safety Conference will now become an annual event to discuss with OHS practitioners and stakeholders what the prevailing challenges are in occupational health and safety that are faced here in Fiji and what are faced at the national level and the enterprise level, and hopefully as a result, together the parties will be able to come up with suggestions for national level strategies and enterprise level strategies to mitigate the challenges that are faced in the field of occupational health and safety. We are working together with the support of our tripartite partners, workers and unions, and the International Labour Organization to collectively help to create a safe and healthy environment for young workers by providing the right tools and training to complete their work safely, educating young workers about workplace health and safety rights and responsibilities, and very importantly, empowering young workers to have the confidence to speak about safety and health in the workplace. A lot of times the young might not feel empowered enough to be able to voice their concerns. And if they are told to do something that they can obviously see that it's dangerous, but because they're not empowered to voice their concerns, they just go ahead and do it, even though they know it's dangerous for them. Madam Speaker, statistics show that 18 to 24-year-olds are more likely to have a serious accident at work than older adults. They may be exposed to poor working conditions, leading to the development of occupational illnesses while still young or later in life. And being new to the workplace, young people may lack experience and often lack both physical and psychological maturity. They may not take seriously enough the risk that they face. And this is very important for us to address. In Fiji's context, the global statistics that I just mentioned above is no different from Fiji. Our statistics recorded at our ministry show that over 32% of reported cases for the past 6 years, or reported occupational health and safety cases, over 32% is for the age group between 20 to 30 years. So this one group of only a 10-year span, they account for 30% of all the occupational health and safety issues coming into our country. But if you just take the age group from 26 to 30 years, this particular age group recorded the highest number of reported cases. For the period, for the past 6 years, that age gap from 26 to 30, that five-year age group, they accounted for 17% of total cases reported for occupational health and safety. And in 2017, this age group, the 26 to 30, recorded 18% out of all the OHS cases. So this is for people working from the age of 18 to 55 to 65, or some people working up to 70. Vast majority of the cases is for people between the age of 20 to 30 And within that bracket of 20 to 30, the majority is from the age group of 26 to 30. And this is the area where we have a lot of vulnerability in terms of injuries and illnesses taking place in the workplace. I've also mentioned the fact that young tend to be very gung-ho about issues. Recently we had the issue about asbestos, if you members will recall, about the issue of the civic center. Asbestos is not something that kills you today, but if you get one of those 5 or asbestos, you breathe it into your lungs, it can lead to cancer in 20 years' time. A lot of young people, when they hear about these things, they think it's never going to affect them. But we need to be able to train them and get them to be aware of these things that if they are not careful about, can have a very bad impact on them later on in life. Other factors that put young people at greater risk include insufficient skills and training, not being aware of their rights and their employers' duties, employers not recognizing the additional protection that young workers need, and employers need to be aware of their responsibility to protect the safety and health of workers, and they should pay particular attention to young workers. They must carry out a risk assessment before a young person starts work and puts in place measures to protect them. Young workers should be given appropriate work and provided with adequate training and supervision, and employers should promote a strong safety culture and involve young workers in safety matters. These issues were discussed at the National Occupational Health and Safety Conference, where we had OHS officers from industry. I'm glad that that message will be taken back and that they will be able to implement programs within the vicinity of their own organization to address this issue. Leadership and work culture plays an important role in understanding and influencing the behavior of young workers. Everyone who employs a young worker should demonstrate effective leadership in work health and safety that can positively influence a worker's values and beliefs, how they perceive risk, motivation, safety knowledge, compliance, and participation. Of course, if the senior workers and the elder workers are more gung-ho in their attitude and they start taking risks with their own lives, that sort of an attitude will be passed on to the people that work under them. So we've been very stressing very consistently with enterprises that this should be addressed within all employers. Young people should be given safe and healthy jobs that are within their capabilities and not beyond their capabilities. They require proper training and supervision. They need to be actively engaged if they are to take on board the safety culture of their workplace. It is not enough to simply provide them with a handbook of safety rules. With the necessary encouragement and support, and by developing their knowledge, understanding, confidence, and competence, young people are far more likely to play their part in managing the risks and possible ill health associated with their jobs and become tomorrow's health and safety champions. Today, the good thing that's happening in Fiji today, young workers are learning about the basics of risk prevention at school and college. If you look at a lot of the curricula that we now have in the FNU and in other places, occupational health and safety is being incorporated into their curriculum. This gives our workplace a foundation to build upon and ensures that young people are more receptive to occupational safety and health in the workplace. Fiji's statistics on workplace injuries continue to be a concern for my ministry, with a total of 1,636 injury cases reported in 2017 through our Workers' Compensation Service. And that is something that we will continue to try to focus on, to try to reduce into the future. The other aspect about vulnerability of young workers, Madam Speaker, that we need to be wary about is their vulnerability in terms of health. So now, in my ministry, we now have a stronger focus on occupational health and not just on occupational safety. Occupational health at the national and enterprise level. And we are now looking to integrate health promotion activities into the normal OHS activities. OHS policy activities, OHS training, promotion and workplace audits, and look at this together with occupational health. Now in our country we know we have the big disease, the big problem that we face around the Pacific and Fiji is number one, climate change. Number two, the other big tsunami, which is NCDs, non-communicable diseases, have reached an epic proportions, causing around 80% of deaths in our country. What does that mean? That means 80% of us members of parliament will die from something that we could have avoided. 80% of all of us, members of parliament, we will die. So 80% of all of our youth now will die from non-communicable disease. If we don't put a stop to it, that percentage will rise higher and higher. So non-communicable diseases is going to have a significant impact, and we need to have government has put in a lot of policies. We put in the taxation of sugar-sweetened beverages, all the policies in the Ministry of Health, but I think we need to pay a lot of special attention to this. NCDs affects the quantity and the quality of the workforce. So the untimely death of workers, disability as a result of stroke, and diabetic-related blindness and amputation ultimately results in long-term impacts on the labor supply, national productivity, and GDP. And also wish to highlight that work-related stress, tobacco use, and exposure to secondhand smoke, the abuse of drugs and alcohol, violence, HIV and AIDS, poor physical activity and nutrition, sleep disorder, and poor rest represent serious risks for workers. They can be responsible for a greater number of occupational accidents and work-related diseases which lead to injuries, incapacity, and death. Those problems affect a significant proportion of the workforce, including young workers, and this has quite an impact on the productivity of enterprises. They have a huge impact on the individual's health, as well as the healthcare system and on the enterprise in terms of increased healthcare costs. Internationally, the workplace has now become the ideal venue to deal with emerging psychosocial risks. So promotion measures must be adopted to address them. Workers spend a large proportion of their time at work. There is also a large potential for influence and change, and the support from colleagues can be critical. For young workers, a certain amount of peer pressure is also a consideration. It is not difficult to understand how poor public health can affect workplaces if we take into account general workers' health and the cost of frequent illnesses or incapacity over the long term. Some examples that come easily to mind regarding work conditions that affect public health are stress-induced heart attacks, a culture of overtime in the organization which has a negative impact on sleep, food availability at work, and I must congratulate Parliament for the lovely food that we're getting now, lots of fruits and salads and vegetables, and I think that's a good example for the rest of the country. Madam Speaker, on the positive note, some examples of workplace measures to promote healthy lifestyles are smoking bans at work have reduced overall smoking, the use of stairs as opposed to lifts, and walking or cycling to and from work has become even more common. Effective workplace health promotion programs should complement OHS measures and should be integrated into the OHS management system of an organization. These are new initiatives that my ministry will aggressively pursue to ensure that enterprises establish and maintain a safe and healthy work environment, enhancing the quality of working life and optimal physical and mental health at work. This will enable workers, especially young workers, to cope more effectively with work-related, personal or family problems that may impact their well-being and work performance, such as stress, violence, or the abuse of alcohol and drugs. This will also allow young workers to become proactive in their health care in order to improve their lifestyles, the quality of their diet, their sleep, and their physical fitness. I thank you, Madam Speaker.